Welcome to this webinar module training. We're going to be covering coordinated care organizations, CCOs. My name is Liliana Villanueva and I'm the Regional Outreach Coordinator for Southern Oregon. The objectives for today is we're going to be reviewing what a coordinated care organization is, understanding CCOs, and engagement opportunities. So we wanted to take a step back and just go to the fundamentals of what a CCO is. Since we are moving forward with CCO 2.0, we just want to take some time and just talk about what a CCO is for some people that may be new to the Community Partner Program and others that may want a refresher. What is a coordinated care organization? So a coordinated care organization is a network of different types of providers who come together in their communities to provide patient-centered care. CCOs focus on providing care in their areas. They have coordinated care that includes physical health, behavioral health, oral health, and social services. What do CCOs do? They have a triple aim. They want a better health, better care, and lower cost. CCOs focus on prevention and helping people manage chronic disease such as diabetes, hypertension, and they aim to reduce unnecessary ER visits and help support people with their health. Why do we need a CCO? CCOs help bring lower cost, provide preventive care, help people manage their chronic disease, avoid going to emergency rooms, help coordinate their care, and integrate dental, physical, and mental health. There are also person-centered organizations. They want to focus on the person and make sure that people stay healthy and help them create treatment plans that will help them thrive. Key factors of a coordinated care organization. CCOs are locally governed, and we'll spend some time later in this webinar talking about advisory committees that people can be part of. CCOs are accountable for health outcomes in the populations that they serve, and they are governed in partnership with health care providers, community members, stakeholders, and are fiscally responsible and the risk. How does a client get chosen to a CCO? So let's find out. So how do we get chosen into a coordinated care organization? So we're going to take some time and talk about choice counseling. Choice counseling is a way that a CP, so community partner, can help a client with the navigation of the CCOs in their area by providing them with the quality information so that clients can make informed decisions on their CCOs. This only happens if your area has more than one CCO. For example, community partner gets asked, what is the difference between a CCO offered in my area? What is the difference between the CCOs offered in my area? The CCO should provide the client with informed information of the CCOs available so that that decision can be made by them. So everyone must be familiar with this screen. This is after you've done the application. This is what the screen for CCOs that pops up in the one system. In this example, you see that Erica Smith has the option of Willamette Valley, and that's the only option provided because that is the only CCO in that area. So they don't have an option of choosing any other CCO. CCOs are based on, CCO choice is based on individuals' physical county and zip code, and if the CCO has the ability to take on more patients. And this is only, the choice only happens if there's more than one CCO available in someone's region. You have, this is the submitted page of your CCO, knowing that that DHS and OHA are the ones that are going to inform you of the final CC enrollment, that you, if you have an option, you can choose which CCO, but the final decision will come from OHA and DHS. So if I had a pointer and I could show you, we're going to focus on this beautiful graphic that we created on the application and the approval part, because there's 3 functions that can happen when someone applies. You can get approved, you can be pending, or you can be denied. So we're going to be focused on someone getting approved. Everyone will be, once you apply to OHP, everyone ends up being on open card. And they typically will get assigned to a coordinated care organizations, and we'll talk about populations that stay on fee-for-service open card or have the option of staying on fee-for-service open card. So here you have another graphic where you have open card fee-for-service, and you have assigned to open card, not a CCO. So these populations can are assigned to open card and cannot be assigned to a CCO. So COWM, COWM Plus, and people with other major medical coverage, TPO. American Indian and Alaskan Natives are the only population that can choose to stay on open card or have a CCO. Individuals seeking continuity of care and pregnant women may request to be on open card as well as COWM. So now we have the second step, the third step, assigned into a CCO. So you have a coordinated care organization. So once someone is assigned and a member of a coordinated care organization, they will receive a packet with information about their CCO and their provider and all information provided from that CCO. If there is more than one CCO available in that area, an OHP member can change CCOs in the first 30 days prior to during their choice period, or once every year. You can make those changes on the applicant portal within 30 days of being assigned if there's multiple CCOs in your region. What happens if a client asks a community partner CP about choosing different providers? So we want to make sure to let community partners know that they can refer any client that has questions about their CCOs to their CCOs, and you can help them with finding the right number or the right person, but it's really the client or the applicant's job to connect to the CCO to make those changes. If you have someone that's on open card or fee for service, you can give them the contact information to the nurse advice line. Also, a person that is on open card or fee for service has no restriction to geographic areas. So that means that you could live in Medford and be on open card and seek services in the metro area like Portland. And open card is accepted with any medical provider that will take the coverage of open card or fee for service. So remember, in the beginning we talked about how you could engage with CCOs. CCOs are always looking for members to attend their local community advisory meetings. These subcommittees are in every region, and on the last slide, second to last slide, you will see links and you can click on them. We'll provide the links to them, so you'll be able to connect to those resources. And CCOs also have different opportunities in their local area. So again, CCOs govern locally, so they are part of the community, and they have local councils that people can be involved in, like community members or you as a community partner as a stakeholder. And if you want more information, we will provide the links where you can contact the local CCO or the local community advisory council. And I wanted to thank you so much for tuning in and listening to what a CCO is. See you next time.